We had promised each other that we were going to take it real slow, but that all changed because she had to fly over and basically save my life.
Just kind of like this life or death situation where, I felt like needed to drop everything and go be by Josh's side.
We had been dating for only about a month when I got into my accident in Thailand, and I was 8 days into my trip. It was the day after my birthday, and we had rented some scooters. I was taking in the beautiful vistas and the wide open ocean and noticed that, oh wow, I'm going too fast for this turn. So tried to make it around the curve and just didn't quite make it. Found myself basically sandwiched underneath the guardrail with the bike still between my legs. My femur on my right side had been snapped in half, clean snap, and then my left side had been pretty much shattered into pieces. My left leg had basically been turned into a Twizzler, where my foot was sticking backwards as they pulled me out from underneath the guardrail.
And me being like my nursing background, I could just see him going downhill, and so I immediately knew that he was starting to go septic.
In the 8 weeks I was there wasn't a point where I wasn't in excruciating pain.
His doctor did come to us at the bedside and said, this infection isn't going to get completely cleared. We just need to get him well enough to fly home.
Josh's condition was very challenging. The femurs were broken and both had not healed. On the left side, he had active infection in bone that was not alive, a bone that didn't heal, and nerve damage that made it where his lower leg did not work. So the first thing that we tackled was his active infection. Then we started looking at his overall condition and how can we best optimize his ultimate function. We knew that some sort of amputation was probably in his best interest.
It seemed like the most logical path forward to get back most of my life, the life that I had before my injury. To have your leg amputated, you deal with physical loss. It's almost just like losing a pet or losing a loved one. There's a part of you that's being taken away that you're never going to have again.
We knew that with all these other options, there was no guarantee that he would be able to walk. Yes, we might save the bone, but can you walk? We're not sure.
He was missing so much bone that he was left with a very, very small piece of femur, really essentially just the hip joint, which is not very functional. He wouldn't be able to wear a socket prosthesis. So we said, what can we do? And that's where the team came together and the thought about doing the turnplasty, where the knee joint essentially and the ankle was amputated. And then the ankle side of the tibia was turned upside down and connected to the small remaining portion of femur that he had. So effectively giving him an above knee amputation made out of his shin bone turned upside down.
You see the magazines and you see other amputees and their life with a socket, and it seems so picturesque, but for me, it ended up being a nightmare. I would spend most of my time in my wheelchair. I couldn't walk more than 30, 40, 50 feet without being completely winded. It was just very cumbersome. A lot of my identity was built through my being able to be physical. I built a roofing business around that, and all of that was pretty much on hold until I could figure out how to be more mobile. It was a challenge, and it was putting me in a lot of depressive states.
I could tell it was really putting a lot of strain on him and his own identity, and he just kind of lost a little bit of his spark.
So after 4 years of fighting with sockets, I was like, I need something else because this just isn't working.
Osseointegration is a difficult surgery in the best of circumstances.
We're able to introduce a bone-anchored prosthesis into their skeleton. And the term osseointegration comes from the bone growing in and integrating into that implant.
I went to Stoneback and he basically said to me, he said, you're not a candidate.
Josh had history of infection, which was something that we were concerned about. He had a above knee amputation with an upside down tibia and was walking on the back of his knee, which has a large artery called the popliteal artery that was running directly over the end of the bone where the osseointegrated implant would go. There's a concern that he could bleed to death just by inserting this implant.
So I went home that day and I cried myself to sleep. I woke up the next day and I asked him a lot of questions around like, how can I make myself a candidate for this?
And so when we were talking about osseointegration and the risks involved with doing the procedure,
I said, so how has this gone before? And he says,
Josh, this has never been done before in the world. And he kind of understood what we were talking about.
I am the first patient in the world to have had these coinciding surgeries.
Dr. Donaldson and I moved the artery out of the way in order to set the stage for osseointegration. We're able to make an implant that permanently affixes to the patient. And not only do they then reharness their normal anatomy and their alignment and the muscles that they use to function their limb.
I could never, ever do that.
They also get a phenomenon called osseoperception. So they're able to feel through the bone and through the integrated implant. It's really a limb replacement surgery. About 6 weeks after we did his surgery where the implant comes through the skin, he was fit with his prosthesis and he stood for the first time. And the smile on his face was pretty awesome.
Oh. See it? Cool. Whoa.
This is the way homework works in this program.
That is cool. Well, I can feel the ground. The osseoperception is probably the best game changer for me as far as this surgery goes. I had a roofing business and I couldn't get up and down ladders because I couldn't feel the rung. And to be able to have that feeling was the moment where I was like, I can run my roofing company again. I can do this. And just to be able to feel grass versus hard concrete or gravel and know when you're on loose dirt and being able to keep yourself from falling because you can pick up that information through your bones, through the leg itself.
There was this one moment we were walking in the grocery store and it was after OI and Josh had like this perfect gait and he was walking so fast and I couldn't keep up with him and I started crying. And it seems so silly that like I'm crying in a grocery store, but it's just like these simple things of just like watching him be his normal person again.
This campus and all of the wonderful, talented people that I have the privilege to work with, putting our heads together and our individual skill sets to make these sorts of things happen for people who have often been told there's no hope, there's no way forward, we have no options for you. But our program, the limb restoration program, is able to find options when others think there aren't. It's been the best part of my career, and so that's why I do what I do.
As soon as I started working with limb restoration, I knew that I was in good hands. Up until that point, I was pretty much questioning everything and I didn't know what my future was going to look anything like. This road has definitely taught me so much humility. It made our bond stronger and it has made my life so much better that we can really appreciate how much better it's made it.